Hey everybody, Van Merkle here, Dr. Merkle. I want to give you a quick tip on the most important thing you do for a report of findings. Years ago when I got in practice, I started writing a report down for everything. For workman's comp, PI, insurance, even personal pay. I always wrote a report out. To let the patient know I'm spending some time, that I give them a report that they can review and look at again. It wasn't necessarily extensive, but I would write down the obvious things: chief complaints and primary exam findings, lab findings, x-ray, physical exam findings, etc. I'd write it down, then I'd have a treatment plan. Home care, if it was an injury, ice and stretching, that kind of thing. And then also a treatment program, maybe as twice a week, 3 times a week for a couple weeks, and any physical therapy that we're going to do. It was all written down. That really helps the patient know that it is serious, how important it is. In nutrition, I do a lot of nutrition in my practice, and I write reports for everything, extensive reports. This is about an 18-page report that I do for patients. This really helps the patient understand the significance of their problem. I know some doctors that do lab work like I do, and they just get the report from LabCorp, scribble on some notes, and hand that to the patient. Versus a written report that's color-coded. It explains in detail what's going on. It explains in detail the test results, explains in detail, it actually shows the test results in a color-coded pattern. This is going to help you manage the patients because they see what's going on, they can understand it, it's easy to read, and they can refer back to it over and over again. Your patients ask you the same questions. Most all the questions are in the report, so it's going to save you time, help you have better compliance with your patients, and they're going to understand and be able to refer to you because they got something they can see. So major tip number 1, start writing it down. I'm Dr. Merkle.